Sandra, and I will be inserting a Foley catheter using sterile technique. First, I'm going to verify that my client does in fact need a Foley catheter. So, insert Foley catheter, urinary retention. Patient is unable to urinate, and this is for Charlene Knight. She's allergic to latex, penicillin, and betadine. 8/8/1939. So I'm just going to go into my patient's room, perform hand hygiene. Hi, I'm Cassandra, and I'm going to be your nurse for today. Can you please tell me your name and your date of birth? So Charlene Knight, 8/8/1939. Allergic to latex, penicillin, and betadine, and that does match my provider's orders. So I hear you've been having trouble voiding or urinating, and your doctor has ordered a urinary catheter. So I'm just going to assess the site and make sure that it's okay to insert the catheter. I'm going to put on a pair of gloves since I will be touching the perineal area. The area looks clean. I'm also going to note that she had her hygiene done earlier this morning, so I don't have to clean anything. I do see the urinary meatus, and now I'm going to palpate the bladder. And the bladder does feel a little bit distended. And do you feel a little bit of pressure? And she does feel some pressure. So I don't see a reason why I shouldn't insert the catheter, so I'm just going to get that for you to relieve some of that pressure. So I'm going to take off my gloves, and then I'm going to perform hand hygiene. Okay? So now I'm going to check my catheter, and it has nothing that the patient is allergic to, no latex, betadine, or penicillin, and it is a 14 French, just like the doctor has ordered, and so now I can get rid of my provider's order. And now, okay, so my bag is intact, and so I can just take it out now. I'm going to use my bag as a catheter, so I can put her in the position now. And I'm going to put down her side rails. And then put her in the position, the proper position. Okay. And now that I have touched the patient, I'm going to perform hand hygiene and then start the process. So first I'm going to open the side that's away from me, staying within my 1-inch border. And then I am going to do my left, not crossing over my field, and then my right, and then the side closest to me. And I'm also going to move my field. Okay. Still only touching the 1-inch border. And so first I am going to, and I also want to make sure that I don't turn my back to the field. I'm going to step away and then open up my thing, and then shiny side down without touching the patient. Okay, so now I'm going to grab my gloves, making sure not to touch the white part. Okay, I have my gloves. So now I can since I am right-handed, I'm going to use my non-dominant hand. I'm going to step back or step to the side since I am a little far. And I'm going to put on my gloves. And now I'm going to go under. And that is touching the paper, but it's still within the 1-inch border, so that's okay. Step back. And then try to put on my gloves. Okay, so now I am sterile, so I can just fix my gloves appropriately. Okay, and now my gloves are on. So now, since I am sterile, I have to keep my hands above my waist, and I'm going to get my step back, open it, and put it open. Okay, and now I can take my hydrogen peroxide, step back, open it to make sure that no water gets on my sterile field, because once water gets on my sterile field, it is no longer sterile. And then I'm going to throw it away. I'm also going to get my petroleum jelly, step back, tear it open, and then just put it on this side. And I'm going to throw it away. Now I'm going to just move my box a little bit, staying within the 1-inch border, and then I'm going to take my syringe and just exercise my plunger. Getting out all of the air. Okay, so everything's okay. Now I could just put it back and then take this out and just move it to the side. And now I'm just going to take out my catheter, unsheath, and catheter, making sure that nothing really wiggles around so that it does not become contaminated. And then I am going to lubricate it and then put it back in the bag. I am also now going to insert my syringe, noting that this does say 14 French, 5 to 10 milliliters, and this is 5 to 10 milliliters of sterile water. And I am also going to note that if the manufacturer required it, then this would be the time that I would inflate my balloon, but the manufacturer does not require it. So now I'm going to move my sterile field. And now I can turn my back to here because my sterile field is now here. I'm going to drop it, making sure that I do not touch the patient's leg, because that would be breaking sterile technique. And now I'm going to use this hand to keep the labia, open. So I'm going to clean outer labia majora, inner labia majora, around, middle, around, and then the outer closest to me, around, inner, around, and going from clitoris to anus, and then middle. Okay, so now I'm done with these. I can also discard these. And now I'm just going to move this to the side because I really don't need it. And it's trash now. So. And now, well, I don't really need this, but it's not bothering me in any way, so I'm just going to leave it in the bag. And now I'm going to start the insertion process, never really removing my hand from this area. sure that my hands do not touch the laziness. I see urine, so I'm going to go about an inch or two more. My hand is not touching, so I'm going to hold it with my unsterile hand. And then inflate my balloon. Okay, and now I can use toilet paper. So my catheter is done, so I'm just going to give it a little tug, and that's it. And so now I'm just going to take this, and then stick it to the patient's eye, whatever adhesive that the manufacturer provides or whatever she prefers. And then I'm going to take the bag and then put it on the stationary part of the bed, not anywhere that moves. So my therapist can bring it over, so now I can just take everything off. And then, are you feeling okay? Is it feeling better? Like, are you feeling better? And then if I would need a urine